Welcome, Honorable State Minister of Health in Rwanda, Dr. Ivan Butera.
My name is Katie Dane and I'm the CEO of the NCD Alliance, and I'm here in the beautiful city of Kigali in Rwanda for our 4th Global NCD Alliance Forum.
Welcome. I'm here in Kigali, Rwanda, the home of African development, the cradle of African development. I'm Ferdinand Sonyai Bitonyai, the chair of the Secretariat of the Africa NCDs Network.
The forum this time is strategically located in Rwanda and sub-Saharan Africa for the first time, given the burden of NCDs across the region, as well as the leadership, innovation and solutions from many countries across the continent. We're delighted to be working together with our local partner and host, the Rwanda NCD Alliance, together in collaboration with the Rwanda Minister of Health and the Rwanda Biomedical Center to make the forum happen.
We're excited to receive the entire world here in Kigali, Rwanda for the forum.
You can expect to be inspired by what's working across the world on NCDs, to be motivated and committed to the high-level meeting on NCDs next year, and to come away with more connections and collaborations across the NCD response. We have a really rich programme for the forum, including a breadth of NCD issues across plenaries, parallel sessions and satellite sessions, as well as many opportunities for networking and meeting new people. This will be a truly unique global convening of the NCD community.
It's time to lead on NCD prevention and control. Thank you.
It's time to lead on NCDs.
My name is Nadine Karema. I'm the Executive Director for Partners in Health in Rwanda. It's an honor to be the MC of the opening ceremony for the 4th Global NCD Alliance Forum. Welcome, and welcome to our non-English speakers. Bienvenue, distingués invités, mesdames et messieurs. C'est un honneur de vous accueillir en cette journée inaugurale du 4e Forum global de l'Alliance internationale de lutte contre les maladies non transmissibles. La cérémonie d'aujourd'hui se déroulera en anglais, donc si vous ne l'avez pas encore fait, veuillez voir nos intendants habillés en t-shirt blanc pour avoir un casque d'interprétation ou de traduction de l'anglais en français. Para español, es Canal 13. In French, it's Canal 2. I am honored to welcome you to this 4th Global NCD Alliance Forum under the banner theme of Leadership on NCDs towards 2025 and beyond. I also welcome you warmly to Rwanda, our beautiful country and the city of Kigali. As you've seen from your drive and your walks, we are the land of 1,000 hills. Our hills, our rivers and valleys are home to a rich and vibrant culture and history. To give you a glimpse and a taste of our culture and history, please welcome the Rwandan dance troupe Inganzo Ngari.
aho ni wanyubaho aho ni wanyu baraza bakuza urugero amacumu bari warishaka bitihinda aho ni wanyu rwizira ngo abarwa mugenge icumu ryanjye ni ikigembe
And believe me, this is just an avant-goût. You will get more of this in the evening. Thank you, Inganzo Gari, for showcasing our culture, the special dances and songs that we only reserve to the most precious guests who are in this room. And thank you for showing our culture and history of celebrating strength and elegance. Ladies and gentlemen, I hope now you've worked out your jet lag, right? Do you now feel that you're in Rwanda? Good, good, good. It's an honor for me to stand before 700 leaders from across the non-communicable disease community. You have come from 66 countries around the world, and I can sense the anticipation, the energy, and your commitment to accelerate progress on NCDs for everyone, everywhere. This goal is dear to my heart and to the heart of the organization that I represent here, Partners in Health, which I lead in Rwanda. Since 2005, Partners in Health has been working in Rwanda, supporting the Ministry of Health to provide equitable and high-quality healthcare with a focus on vulnerable populations. It's been a pleasure for me to be part of the National Planning Committee, which has helped shape a fantastic program of events that you will be seeing over the next few days. So let us get straight into it, starting with our amazing speakers for the day. I am pleased to welcome Dr. Monica Arora, President of the NCD Alliance and Executive Director of RIDE. Please, Dr. Monica, and as you walk, please let's welcome her with a round of applause.
Good afternoon and namaste from India. Honorable Minister of State, Dr. Ivan Butera, delegates, ladies and gentlemen, it is my honor to warmly welcome you to the 4th Global NCD Alliance Forum in the beautiful city of Kigali. We are delighted to be hosting this forum in sub-Saharan Africa for the first time, and in Rwanda, a country that has made remarkable progress in health and NCDs and is a champion regionally and globally. So let me start by thanking Honorable Minister of State, Dr. Ivan Butera, the Ministry of Health, and Professor Claude Mambo Muvunyi, Director General, the Rwanda Biomedical Center, for their leadership and collaboration. I would also like to thank the Rwanda NCD Alliance, our local host, the Leona M. and Harry B. Helmsley Charitable Trust, our strategic partner, that shared our vision for this event right from the outset. We would also like to thank our 38 other sponsors for their collaboration and partnership. Ladies and gentlemen, it was 5 years ago, almost to this day, that we convened in Sharjah in UAE for our last forum under the patronage of Her Highness Sheikha Jawahar bin Mohammed Al Qasimi. In these short 5 years, the world has changed dramatically. We are living in polarized and uncertain times. Rising geopolitical tensions are very evident. The US government announcement to freeze foreign aid and withdraw from WHO has sent shockwaves around the global health community, paralyzing health programs and overturning the health financing landscape as we knew it. The era of polycrisis is upon us, with pandemics, climate change, conflicts, and humanitarian conflicts clocking horns in all corners of the world. At the center of this storm are people living with non-communicable diseases and the vulnerable children exposed to NCD risk factors. I would like to take a moment to hold space for the 215 million people that lost their lives during the NCDs in these past 5 years. 215 million. These aren't anonymous numbers. These are people we know, members of our community, our family members, our friends whose precious lives could have been saved. 156 million of those people lived in low and middle income countries, such as my home country, India. Agonizingly, 90 million of these deaths happened before their 70th birthday. They could have been prevented or delayed. Ladies and gentlemen, these numbers are unacceptable. To put it bluntly, promises made by governments are ringing hollow. Progress towards 2025 target is wildly off track, and the 2030 Sustainable Development Goals hang in the balance. Today, there are 1 billion people living with obesity, 1.3 billion are hypertensive, 1 billion are living with a mental health disorder, and 500 million people are living with diabetes and chronic respiratory diseases. These numbers dwarf many other health issues combined and are likely to be just the tip of the iceberg. We know well that prevention is the answer for turning the tide on NCDs. Strong inroads have been made due to the hard work of many in the audience in creating healthier environments and reducing the risk factors. Many countries today have legislation in place to tax unhealthy products, restrict marketing, and improve front-of-pack labeling than what it was 5 years ago. Yet still, the prevalence of risk factors remain stubbornly high. No doubt the multinational companies that are fueling this epidemic are celebrating this as a win. Profits are still trumping lives. The burden of NCDs not only impact health in our societies, but adversely impact the human capital development and economic prosperities of our countries. For governments and families alike, they represent an economic emergency, draining health budgets and pushing whole families into cycle of poverty. Still today, access to care remains a distant reality for millions of people living with non-communicable diseases in low and middle-income countries. Postcode lotteries are still determining if we have access to life-saving treatment or not, if we live or die. Health systems are not wired to respond to and manage chronic diseases. But this should not be the way. The solutions, the science, and the levers are at our fingertips. We are ready to go when it comes to the how part of this problem. What is needed is political leadership and financing to rapidly scale implementation. And we are seeing glimmers of hope, glimmers of success that we can point to and be re-energized by. Victories of legislation that are promoting healthier environments, the step change that we have seen in commitment to meaningfully involve people living with NCDs, something that we have been calling for 5 years ago in Sharjah, and the leadership and growth of the NCD civil society that is so evident in this hall today. It is important we celebrate these successes, learn from them, and unite. Particularly this year, the 4th UN high-level meeting on NCDs year. And this is why we have gathered here in Kigali. Over the next 3 days, we come together under a shared objective to ensure this high-level meeting year is truly a turning point in the NCD response. We have 72 national and regional NCD alliances present, many of our members and strong lived experience advocates with us here. We also have 60 youth delegates with us to shape the NCD agenda and response. We look forward to the launch of the Call to Lead and the Kigali Youth Statement into a comprehensive and equitable response to NCDs. Our vision and goal for this forum is that it is a fueling station, a strategy touchpoint, and a catalyst for action and partnerships. Our program spans across 5 plenaries, 21 parallel sessions, 18 satellite sessions, and is structured around 3 themes or ingredients needed to move the needle: leadership, financing, and community. In these turbulent times, we need bold leadership and leadership that embraces solidarity over division, co-creation over isolation, and collaboration over self-interest. The NCD community is impatient for change, and this year's forum is our opportunity to see it happen. Thank you.
Thank you for your words of hope, Dr. Monica. I now welcome Professor Joseph Muchumbitsi, chairperson of our local host organization, the Rwanda NCD Alliance, and vice chair of the planning committee for Rwanda for the 2024 Global NCD Alliance. Welcome, Dr. Muchumbitsi.
Honorable Minister Butera, distinguished delegates, ladies and gentlemen, good afternoon and welcome to Kigali and Rwanda, the land of 1,000 hills and the land of culture, as you have seen. I'm Joseph Muchumbitsi. I'm a pediatrician and cardiologist and outgoing chairperson of the Rwanda NCD Alliance and outgoing president of the East Africa NCD Alliance. It is so a privilege to co-host a national, it is so a privilege to co-host this breaking ground Global NCD Alliance Forum, the first in the Sub-Saharan Africa, it has been said, and also the first to be co-hosted by a national NCD alliance alongside the host government. I would like to extend my gratitude to the NCD alliance and to the Rwanda government for their leadership. Ladies and gentlemen, Africa stands at a pivotal moment. Over the last 2 decades, the continent's healthy life expectancy has risen by 10 years, the highest global increase. And in Rwanda, it has increased by over 20 years, thanks to the progress in maternal and child health, the control of infectious diseases, but yet these gains are threatened by the silent but deadly rise of NCDs. NCDs now account for over 1/3 of death in Sub-Saharan Africa, where we are, up from 24% in 2000, which is a significant rise. Within 5 years, they will surpass HIV/AIDS, tuberculosis, and maternal mortality as the regional leading cause of death. The African context presents unique challenges. We have only need to face poverty, infections, and malnutrition, which exacerbate the burden of NCDs. And the big 5 NCDs are joined by others less recognized, such as type 1 diabetes, rheumatic heart disease, and sickle cell disease. The continent is home to 67% of the world's poorest population. And the face of NCDs here is much younger because the mean age in our continent is 19 years old. Limited awareness, late diagnosis, insufficient access to care due either to inaffordability or unavailability worsen the crisis. Only 1 in 7 people with diabetes in sub-Saharan Africa consistently access insulin, compared to 1 in 2 people in developed countries. Childhood cancer survival exceeds 80% in high-income countries, but dropped to 20% in some African nations. People living with NCDs are paying also the price for qualified workforce shortage or drainage, underfunding, and fragmented health systems. Over my 30 years of practice as cardiologist and pediatrician, I have witnessed the surge of harmful tobacco and alcohol use, the shift to unhealthy diets, increasingly sedentary lifestyles, and air pollution across the region. Many of these risk factors, unfortunately, stem from policies beyond the health sector: agriculture, trade, and transportation. Governments must take tough decisions, but necessary investment in prevention. The evidence is clear: prevention pays off. Despite the immense challenges, the past 5 years have seen growing political commitment and leadership, local and regional strategies, and Rwanda is among the champions and has an impressive story to tell. My inspiration from this forum is put a spotlight on these best practices, ignite a strong legacy of regional cooperation, and add to the momentum already underway with more African governments leading on NCDs and leading to ahead of the 2025 UN high-level meeting. Ladies and gentlemen, as Dr. Monica said, together we can build a fair, healthy, and equitable future. We can, together. I wish you a welcome in our city of Kigali and Rwanda. I hope many of you will take some time to visit after the work. We need to relax and visit our country. And I wish you a productive and inspiring forum. Thank you.
Thank you, Professor Muchumbitsi, for highlighting the inequities that still exist, but the progress that we've made toward governance. Now, ladies and gentlemen, I would like to welcome to the podium Dr. Gina Adio-Stratidou, Program Director of the Helmsley Charitable Trust and the strategic partner of this forum. Welcome, Dr. Gina.
Nadine, excellent job pronouncing my name. This is the question I always get. It is really a great honor to be here with such a dedicated partners. You all work here to ensure that people living with NCDs can have full, healthy lives, no matter the diagnosis, no matter where they live. We're in a critical time, not only for NCDs, but I think in general for health. And I want to thank my fellow speakers and those who are working behind the scenes for creating such a space to learn and take action together. As we embark in this, I'm sure, very productive forum, I want to take time to reflect and ask ourselves why we're here. At Helmsley Trust, I'm the program director of the Type 1 Diabetes Program. This is our priority, but we know that Type 1 diabetes does not exist in isolation, neither the people who suffer from Type 1 diabetes. If we want to help the NCD community, we need to build partnerships that center people, not diseases, and we need to strengthen the health systems. We believe that it's very important to eliminate silos. How do we do this in practice? We are here today at the NCD Forum, NCD Alliance Forum, where it promotes leadership. I would like to share with you 3 examples of that showing how we take the lead to eliminate silos in the NCD community. First, keep communities and people living with NCDs front and center. Community-based organizations and advocates living with NCDs, they bring invaluable local insights and leadership no other can. Helmsley is very, very proud to support Panorama Global on the T1D Community Fund, which supports community-based organizations around the world that serve individuals and families impacted by type 1 diabetes. Many members actually of the T1D Community Fund are here. If you see them, please ask them to share their stories. Second, build bridges across multiple health issues. It's important to invest in broadly supportive healthcare systems that help create a world where everyone can thrive, no matter the disease. Here in the Africa region, we are working with the WHO Afro and the NCDI Poverty Network to implement PEN+, a strategy that integrates and localizes care for multiple severe NCDs. Rwanda is a great example. We visited 8 years ago, and there were 3 sites, 3 district hospitals that they have implemented PEN+. We met a young man who was just diagnosed with type 1 diabetes, and he was alive because the district hospital was next to his house. 8 years after, the Rwanda Ministry of Health has expanded PEN+ in all 42 district hospitals, and I hope that they will go even further to implement PEN+ in health centers. They have trained hundreds of health workers to diagnose and treat children suffering from heart disease, sickle cell anemia, and type 1 diabetes. I had the opportunity to meet the young man again yesterday, and he was thriving, not just surviving. He has a family, he's a teacher. This is a glimpse of hope, but we have a lot of work to do. Finally, I think it's important to collaborate with local, regional, and global partners across sectors. It's important to have partners who will commit their time, resources, and knowledge to address the global burden of NCDs. I want to applaud the NCD Alliance for the leadership convening the NCD community year after year. As we look ahead to the high-level meeting on NCDs in September, platforms like this forum, are opportunity for us to coordinate and bring our voices loud and clear. I will close by saying again that it's significant to work all together and really support a global NCD movement. I'm optimistic that someday in the future, we will look back on this forum and see it as a turning point in reaching the future. Thank you so much.
Thank you, Dr. Gina. Partnership, holistic approach, patient first. I would like now to share with you a video from Dr. Tedros. Dr. Tedros could not be with us, but as the Director General of the World Health Organization, he wishes to pass on a message to us.
Dear colleagues and friends, I thank Rwanda's Ministry of Health, the NCD Alliance, the Rwanda Biomedical Center, and partners for hosting this year's Global NCD Alliance Forum and for Rwanda's leadership on NCDs. Every year, NCDs, including cardiovascular disease, diabetes, cancer, and chronic respiratory disease, kill 17 million people under the age of 70, 1 every 2 seconds. 85% of these premature deaths are in low and middle income countries. We have the power to change this narrative. Many of these deaths can be prevented by addressing their root cause, including tobacco and alcohol use, unhealthy diets, physical inactivity, and air pollution. Many African countries, like Rwanda, are already taking action. Driving progress requires sustained political commitment, relentless advocacy, sustainable financing, and a commitment to equity and social participation. I congratulate Rwanda on being among the first countries to receive funding from the Health for Life Fund, which will help to integrate mental health and NCDs into service delivery. WHO is supporting countries in responding to NCDs in many ways, including through the Global Coordination Mechanism on NCDs, a member state-led platform driving multi-sectoral and multi-stakeholder collaboration and action. Thank you all for your commitment to the fight against NCDs and to a healthier, safer, and fairer world. Murakoze Chane, I thank you.
Thank you, Dr. Tedros. And now, ladies and gentlemen, distinguished guests, it is my privilege to welcome our guest of honor, Minister of State for Health in Rwanda, Dr. Ivan Butera. Honorable State Minister, we welcome you to deliver the keynote speech and formally open the Global NCD Alliance Forum. Karibu.
Good afternoon, bonjour, bom dia, buenos dias. Welcome to Kigali. Distinguished guests, esteemed delegates, all protocols observed. It is truly a great pleasure to welcome you all to Rwanda for the 2025 Global NCD Alliance Forum, the first of its kind hosted on our continent. So thank you for all making it here with us today. We are deeply proud to serve as the meeting ground for global leaders, experts, advocates, all united in the fight against non-communicable diseases. This gathering is a call to action at a pivotal moment in global health. We're facing a reality of NCDs, which is no longer an abstract issue, but a reality lived by millions across the world. A few years ago, I sat with a friend at a hospital here in Kigali. He told me that when he was younger, the greatest health threats were infectious diseases like TB, HIV, malaria, and others. I think it's the same for most of people who are in the room here. He said something that really struck me. He told me, and I quote him, "Now we just don't worry about diseases we can catch. We actually worry about the diseases that catch up with us, such as heart disease and cancer." His words highlighted an undeniable truth. Today, NCDs account for nearly 60% of death here in Rwanda. Cardiovascular diseases and injuries alone contribute about 15%, while cancer, chronic disease, and diabetes collectively add to the growing burden. I'm sure this is not only a Rwanda challenge, but it is a global crisis. Each of us here today reflects on our shared commitment to addressing this crisis and ensuring NCDs remain central to the global health agenda, despite the turbulence we are seeing in it. For far too long, the global response to NCDs has focused heavily on treatment, but prevention is where Rwanda chose to begin, and I'll share a few examples of some policy choices that were followed by implementation, steps that are working. Over the past decade, tobacco smoking has dropped from 13% in 2012 to 7.1% in 2022. Innovative taxation are saving lives. Just this week, we raised again excise taxes on cigarettes and alcohol. So from this week on, the price of tobacco here in Kigali and in Rwanda in general has doubled. And we've also increased beer taxes to 65% of the factory price. These policies reinforce our unwavering commitment to reducing NCD risk factors. Community engagement is at the heart of our response. Health education combined with screenings are embedded into our daily lives, whether through car-free days that some of you will experience, workplace wellness initiatives, or school programs. Let me emphasize a little bit on car-free days. 2 Sundays per month, we block the main arteries of the big cities in the country, and they're all dedicated to exercise, cycling, walking, and doing other types of exercises, but you also combine it with screening and linkage to care for those who have crossed the path. So we believe into prevention, but also access to diagnosis and treatment to really complete the entire value chain. Rwanda's community-based health insurance that covers 90% of the population ensure that no one does not get access to care because of limited financial capacity. This year, we took a big step forward, reducing, for instance, let me pick one example, CT scan of the brain by 64%. And we expanded our community-based health insurance with 14 additional services starting this year. So from this year going forward, procedures such as kidney transplant, dialysis, access to a cath lab if you have an acute cardiac event, and other complex care diseases, including open heart surgery, are part of our community-based health insurance and therefore accessible to more than 90% of the population here in the country. For cervical cancer and breast cancer screening services, we are targeting to complete by the end of the year a full national coverage of understanding cervical cancer and breast cancer burden by combining screening and treatment. We have an aim to eliminate cervical cancer by the year 2027. However, there are still many challenges that we need to collectively resolve and invest in intentionally altogether. As we look ahead to the 2025 UN high-level meeting in New York later this year, I urge every stakeholder in this room to take bold actions. For governments to commit increasing financing for NCD program and fully integrating prevention and treatment into universal health coverage frameworks. To regional organizations, strengthen intergovernmental cooperation so that Africa and the globe move forward together in addressing NCDs. To the private sector, invest in affordable point-of-care diagnostics, life-saving treatments, and innovative health technology to bridge accessibility gaps while taking into consideration the heterogeneity that we have here in the world. To civil society and academia, I think we also need to amplify our voices, patients' voices, advocacy for policy change, and generate data-driven solutions that have high impact. Rwanda is a partner to all of you. We recognize that health security is a shared responsibility. We remain committed to advancing a unified global NCD response through bold leadership, strategic partnerships, and decisive action for sustainable solutions. As we move forward, let us lead with purpose, invest with conviction, and act with urgency for a healthier future for all of us. Murakoze cyane, thank you very much, and I hereby declare open the fourth Global NCD Alliance Forum. Thank you very much.